And to your health. Speaking of breast cancer awareness, an important part of Breast Cancer Awareness Month is knowing the risk factors that are involved with the disease, and that includes family history, breast density, and genetics.
Some of those factors can make breast cancer more difficult to detect on a mammogram. So joining us live to talk about prevention and the importance of regular screenings, especially during the pandemic, is Dr. Victoria Mango and Beth Battaglino, registered nurse and CEO of Healthy Women. Good morning to you both.
Good morning.
Morning.
Good morning. So Dr. Mango, I want to start with you. I know we've talked before on our show. I've heard about this dense breast tissue. So let's talk exactly about what exactly are dense breasts and how many women have them.
That's a great question. So as a doctor, when I look at your mammogram, I'm looking to see if the breasts are dense. And what that means is you have more glandular tissue than fatty tissue. And that's extremely common. About half of the women in the United States have dense breasts. And it's very important for women to be aware if they are in that half of the population with dense breasts, because it can make breast cancer harder to find on a mammogram, and it can also increase your risk of breast cancer.
Okay. Well, and I know the last few times I've been in for a mammogram, they've offered me, I think it's a 3D mammogram, I think is what it is. Maybe it's 4D. But are there differences with the mammograms and as far as their effectiveness, and are they enough when it comes to screening for cancer in women with dense breasts?
You bring up a great point, because technology is always improving. A 3D mammogram or tomosynthesis mammogram, your viewers may have heard that word before, that is a more advanced technology and is becoming more and more the standard of care for mammography. But for women with dense breasts, a mammogram may not be enough. They should still get their mammograms, but they should be empowered. They should ask the question of their physician, do I have dense breasts? And if the answer is yes, talk about if additional screening might be warranted. So things like breast ultrasound, or in our highest risk patients, we think about doing a breast MRI.
Okay, Beth, let me ask you. I mean, we've talked for so many years now about the importance of mammograms, and largely, as a culture, have made a lot of strides in getting more screening and awareness out there. But why do we still see so many women dying of breast cancer after such a huge push for more research and treatment and more screening?
Well, you're right. Breast cancer is still the second leading cause of cancer death in women, and approximately 42,000 women in the United States are expected to die in 2020 because of breast cancer. So that's why we're using today, during October, the month of October, to remind women that, yes, it is Breast Cancer Awareness Month, but more importantly, please, please, please make your mammogram appointment. Go get your preventative screenings, because preventative screenings do save lives. And bringing up, and I was so pleased to hear that you have done programs on breast density, because so many people have never heard about dense breasts, or may have heard but don't understand what having dense breasts means. It's a lesser known risk factor for breast cancer, but it's really important to understand whether or not you have dense breasts. And if you do, to have that conversation with your healthcare provider. We put together a really great quiz at understandyourdensity.com that can help you understand whether or not you have dense breasts, but more importantly, help you begin that conversation with your healthcare provider. Because once you understand whether or not you have dense breasts, understanding what additional testing you may need to make sure that if you do have dense breasts, that we're looking for, that potential cancer risk, and diagnosing it earlier.
Yeah, and you mentioned that you've put together this information that people can use to determine that. Where should
Right.
people go for that information?
Understandingyourdensity.com is a great resource, and it includes a quiz that you can take to help you determine whether or not you have dense breasts.
Okay. All right. We'll be sure to put a link to that at coin.com as well. Dr. Mango, Beth, thank you so much both for
Great.
joining us this morning. We appreciate your time.